The real reason your back hurts and how to fix it. Back pain is one of the most common health complaints, affecting millions of people worldwide. Whether it's a dull ache after a long day or a sharp, debilitating pain that makes it hard to move, back discomfort can seriously impact your quality of life. But what is the real reason your back hurts? And more importantly, how can you fix it? The root causes of back pain. Most people assume that back pain comes from a single incident, lifting something heavy the wrong way, sleeping in a bad position, or an old injury flaring up. While these can certainly contribute to discomfort, the real cause of back pain is often a combination of factors, including slouching, hunching over your phone, or sitting without proper lumbar support can gradually lead to chronic pain. Weak core muscles. Your core isn't just about having six-pack abs. It includes muscles in your abdomen, lower back, and pelvis. A weak core cannot properly support your spine, leading to strain and discomfort. Sedentary lifestyle. A lack of movement and physical activity causes muscles to weaken, making them more prone to injury and pain. Sitting for extended periods can tighten hip flexors and hamstrings, which in turn pull on your lower back. Stress and tension. Emotional stress manifests physically. When you're stressed, your body tightens up, particularly in the neck, shoulders, and lower back, leading to stiffness and discomfort. Improper lifting techniques. Many people injure their backs when lifting objects incorrectly. Bending at the waist instead of using the legs and core to lift heavy objects puts unnecessary pressure on the spine. Underlying medical conditions. Conditions like herniated discs, arthritis, or sciatica can also contribute to back pain. These require medical attention and treatment plans tailored to individual needs. How to fix your back pain. The good news is that back pain can often be relieved or even prevented with simple lifestyle adjustments. Here are some effective strategies. Improve your posture. Make a conscious effort to sit and stand with your shoulders back and spine aligned. Use an ergonomic chair. Keep your computer screen at eye level, and avoid hunching over your phone. Strengthen your core. Exercises like planks, bridges, and pelvic tilts can help build core strength, providing better support for your lower back. Stay active. Regular movement is key. Stretching, walking, and low-impact exercises like swimming or yoga can help keep your back strong and flexible. Relaxation techniques such as deep breathing, meditation, and massages can help relieve muscle tension and prevent pain. Lift properly. Always lift using your legs, keeping your back straight and the object close to your body. Seek professional help. If pain persists, consult a chiropractor, physical therapist, or doctor for a personalized treatment plan. By making these small but effective changes, you can take control of your back health and live